Good morning, everyone. Wynn Brown here with Haywood Healthcare's COVID-19 update for Wednesday morning, April 8th. Actually, just almost noontime, so again, just sliding this in under the hour. Let me give you an update on our testing so far. 925 tests have been collected, 672 negative, 125 positive results, and 5 that were indeterminate. Our positive percentage is 15.7 now, comparing to the state at 18.7. Statewide, 81,000 tests collected with 15,000 positive, so that's what you're seeing. Worcester, just 1,172 cases, Franklin up to 118. There was an article out today stating that perhaps looking at the COVID-19 in our region, that perhaps we might peak a little bit later than the urban areas. So we're going to keep an eye on that, and that might be why we're seeing our numbers where they are versus when you look closer to the city. And as I get some more information on that, we can determine whether that's fact or fiction as we look at what's going on, but that was out on the press today. In-house at Haywood, we have 6 positive patients, 3 on ventilators, and 7 patients who are waiting their test results back to see if they rule in or rule out for COVID-19. Just a few thank yous. First to the Indian Association of Greater Boston and their large donation of masks that came in. Thank you to them. Also, our home sewers, we appreciate the great work that you're doing. And actually, now that we are masking everyone who enters our facilities and our administration staff utilizing the masks as well, that we are actually low, especially and actually out of hand-sewn masks on the Athol campus. So I encourage our sewers to continue working on our behalf and our patients' behalf, and get more delivered to us when you have time to do that. Also, hair bonnets and isolation gowns are also things that are being worked on. Just a shout out to Sue Arsenault from Gardner, who's been sewing us masks and also has designed ones that have a HEPA filter built into them. So I just love the creativity that we're seeing. Also, a lot of donations coming into our community, financial support from gifts arriving in the mail to people working with Selena Johnson in our philanthropy department, buying meals for our staff, and then just online donations and gifts have really are helping us. It's a incredibly financially challenging time for us. With our outpatient volume down upwards of 50% across the board, and our inpatient volume for our non-COVID-19 patients very, very low as well. Another shout out to the Tomasetti family, Ken and Kevin from ACT Fasteners. They have been working very hard, they and their team, to make sure that our weekend backpack food program continues to operate, and they are providing space and staff at their facility to make sure that that program is durable and keeps going. And so a shout out to them and their team, which is fantastic. The community is certainly pulling together for us. And then also Wayne from Gardner Public Schools to help us deliver to Winchendon today in the inclement weather. So thank you to them as well. I just thought I'd end today. We have some, in our off time, we're online looking at things, and I was checking out my Facebook account yesterday, and one of my classmates from Bates College, Holly Cody, had a great poem that was posted and printed widely during the pandemic of 1918 and 1919, and it was written by Kathleen O'Mara. So I thought I'd leave you just with this thought in poetry from another time, but very true today. She writes, "And people stayed home and read books and listened. They rested. They did exercises. They made art and played and learned new ways of being and stopped and listened more deeply. Someone meditated, someone prayed, someone met their shadow. And people began to think differently, and people healed. And in the absence of people who lived in ignorant ways, dangerous, meaningless, and heartless, the earth also began to heal. And when the danger ended and people found themselves, they grieved for the dead. They made new choices, dreamed of new visions, and created new ways of living, and completely healed the earth, just as they were healed." So thought from a century ago to us today as we go about our day-to-day, caring for the patients in our community, doing the incredibly hard work that it takes to keep a health system vibrant, during these challenging times. I appreciate everything everyone's doing to support us as we continue our journey to be one of the best community-owned health systems in America. Have a great day.